Thank you. Well, as I go through my pregnancy journey, we are sharing resources for pregnant women and new moms. And today we're talking about midwifery care at LewisGale. Bryn Austin and Ashley Worley are joining us now. Ladies, welcome. Thank you so much for being here.
Thank you for having us.
Now, you're both certified nurse midwives. Can you tell us a little bit about what that means and kind of the process of going through becoming one?
Yeah, good question. So a certified nurse midwife is an advanced practice registered nurse. We each have our bachelor's in nursing. And then we each pursue either a master's or a doctorate in nursing practice as well. So we each have advanced practice nursing degrees, and we all go into it with a love for midwifery, a love for pregnancy, and just a love for the patients that we provide care for.
Yeah. Tell us, what does kind of an ideal candidate look like for midwifery during pregnancy care? Or is there an ideal candidate?
Yeah, so midwifery care is for all women.
Yeah.
Now, pregnancy-wise, we do mostly low risk, and we have a great cohort of physicians that will either let us refer to them or consult with them for our high-risk patients.
Amazing. What do those office visits look like at your practice?
So the visit is a normal visit at the beginning, come in, height, weight, blood pressure, right? And then we sit down and we say, what are your concerns today? What brings you in? Because that may be for a pregnancy visit, but also for a gynecological visit, an annual menopause visit. And so then we delve into that visit as far as whatever it applies to. So in your pregnancy, what does that weekend look like? What should you expect to be feeling? Is this when your baby's first starting to move, or is this when, you know, we're getting close to time for labor and what to expect? And so we talk about those things. So lots of education, lots of anticipatory guidance, and then making sure you know how to reach us in the case of, is it labor time or is there an emergency?
Yeah. What can a laboring mother expect from her midwife during labor?
Yeah, so typically we are very hands-on during a person's labor, with labor support usually. We can be as hands-on or as hands-off as a person would like. But for our patients, we have about half of our patients that go unmedicated and half of our patients that go with an epidural, and we're very supportive of all pain management options. But typically for our patients that go unmedicated, we're there with them at the bedside, giving counterpressure, massage, help with hydrotherapy. We've got really great labor tubs that people can labor in. And then we're there for the partners as well. So very supportive environment.
That's amazing. How do you guys help reduce discomfort during pregnancy? Are there kind of some things that midwives are trained in that can really help with that?
Yeah, so different positioning techniques. We're very much proponents of getting people up and moving during their labor and then birth as well. We're very comfortable with providing labor support and all sorts of birthing positions as well, whether that's in the bed or standing up or hands and knees positions. But we have lots of different tools like labor balls, peanut balls. The nurses are really wonderful as well about helping provide support.
That's
and
amazing.
Then the counter pressure hip squeezes, things of that nature.
I have to be honest, so I'm seeing the LewisGale Midwives for my pregnancy, and one thing that I loved so far, you guys offer so much, you're such a wealth of knowledge, but like the nutrition advice and all that kind of stuff, things that people don't always get from a typical doctor, I feel like you guys are really able to go in depth on it, which I love.
Thank you.
What is unique about your care, would you say?
I would say what is unique about midwifery care is our dedication to evidence-based practice. All providers go into healthcare, and all nurses and anyone in healthcare, I think, goes into it with a love, right? But I think midwives really try to take that to the next level. We want to provide care to women throughout the lifespan, and we love what we do, and so we bring that passion into our care and into providing a very unique, specialized care plan. So if that, like Bryn said, is the person who wants to go unmedicated, or if that's the person that says, hey, I want an epidural when I walk in the door, we are there to provide with, you know, whatever your needs are.
Or if you change your mind halfway through.
Exactly. And we just want to focus on what that person's needs are, provide evidence-based care, trauma-informed care, is we're passionate about that, and really making sure we're following the guidelines by the American College of Obstetrics and Gynecology and the American College of Nurse Midwives. But at the end of the day, it's about you, your family, your baby, whatever's going on in your specialized moment.
And I want to make it clear too, it's not just for prenatal and labor and delivery. You guys also provide well woman visits, OB visits, and all of those other types of services as well, right?
We do. Even through perimenopause and menopause care and all the things in between. I love that in midwifery school, they said from the womb to the tomb. And it is so true, because we're caring for those babies when they first come out and looking at them and making sure they are doing okay right off. But then, adolescence, first period, cramping, things like that. The new mom, someone who needs contraception, someone who's in perimenopause and having hot flashes, all the things, we're there.
Well, ladies, thank you so much. We have some information up on our website too if you are interested in learning more about the LewisGale Certified Nurse Midwives. Thank you so much for being here.
Thanks for having us.